Welcome to Scoliosis Dialogues. I'm Chris Hardesty, a previous SRS traveling fellow, and I'm here interviewing the 2025 traveling fellows who are here at the SRS meeting following their month-long trip across the United States. Welcome, guys. I'd like each of you to introduce yourself and where you're from.
Hello, everyone. My name is Nan Wu. I'm from Peking Union Medical College Hospital, Beijing, China.
My name is Reuben. I'm from Singapore and I work at Singapore General Hospital. Yeah.
Hello, everybody. I'm Sebastien Pesenti. I'm from France and I work in Marseille, in the south of France, in the Latimode Hospital.
Hello, my name is Muharrem Yazici, past president of SRS. I was the senior traveling fellows of this year program.
The Godfather.
Yeah, it's the
Welcome.
Godfather. I mean, sounds good.
It does. And you're lucky. What a wonderful Godfather to have.
Thank
Don't
you,
see
thank
it.
you.
Thank you.
Tell me about the places you visited in North America.
Yeah, sounds good. So we actually stopped. The first stop is from Montreal, Canada. So we visited Saint Justine Hospital, which was hosted by Stephen Parrott, and also we visited Schreiner's McGill University Health Center, which was hosted by Joan Oley. And after that, we went to New York City, where Dr. Larry Lenke and Michael Vitelli hosted us at Columbia University. And we also visited NYU, University of New York, which was hosted by Tab.
Okay, and then shortly after that, we spent a whole week in Philadelphia, with 3 sites within that region. One would be Shriners Hospital, and that would be hosted by Amar Sandani, and the next site would be Children's Hospital of Philadelphia, which was hosted by Pat Cahill, and we took a short drive to Delaware, where we visited Nemours, where Sukan hosted us.
Sukin is an excellent host, so I'm sure you had a great time there.
Yeah, we did have a great time. Because it's a week, we had to sort of share the week out amongst 3 different locations, and so we would have loved to spend a bit more time at each place, but I think we've had great hosts at all points of the week.
Sure.
Yeah.
Where did you go after Philly?
So after that, we went to Dallas, to the TSRH, where we were hosted by Dan Sucato and all his team. It was the longest trip that we had during this travel, just like 3-hour flight. So it was really very well organized trip. And after that, we went to Louisville. That was the final step of our traveling fellow. And we were hosted by Jeff Gum and Steve Glassman.
You went to some amazing sites, and I'm sure this has been an incredible experience. The SRS Traveling Fellowship is a once-in-a-lifetime opportunity, and there's nothing like it. So I have a few questions. Was there a moment during the trip where you thought, this is exactly why I came?
I think basically I told that to myself every day, or almost every day. It totally met my expectations, like in terms of learning in the OR, in the case conferences, discussing the research projects and everything, and also the networking, which was amazing. So yeah, it was not, I mean, it's difficult to find specifically one moment that was over the others.
Yeah, for me, it was about 2 things that I found great. Is that it sort of see this close working relationship between research as well as the clinical side in every of these locations, and that was very eye-opening for me, and certainly something to take home. And of course, the other thing, there's also a good verification of the same kind of surgery and techniques and thought processes that we take on in back home. There's also being done elsewhere in North America, and they're all quite similar. Of course, there's some small differences, but this verification for me is great, because then I can go home and tell the team back home that, hey, what we're doing is in line with what the rest of the world is thinking. Yeah.
So I think the SRS Training Fellow is quite different from other travels or other kind of fellowship program. So I did my postdoc here at Baylor College of Medicine in Houston, USA, and also I spent like 5 months last year to visit different hospitals actually. But the traveling fellow is quite different because we not only have the knowledge exchange, but also the culture, connections. Basically, all the sites showed us the best kind of performance of the clinical medical care for the spine deformity patients. And not only adult, but also peds. And also they showed us the local cultures, meaning that because we are international fellows, so we get to know more about the society and culture of US here. And on the other hand, I think so we travel, especially for the kind of last 2 weeks, we travel as a family. It's not only, as a team, but also we travel, we take care with each other. I think this will be kind of legend or things we get from the traveling fellow, and we spend almost a month working, studying, and communicating, and also living together. So the most expression moment for me, I think, is from TSIH, where because I think during the traveling fellowship, I did see lots of exciting moments and also the historical moments from SRS. When I was visiting TSH, Dr. Tony Herring showed me a picture when he brought a team to visit China back to 1983. That might be the first international trip for SRS, but I'm going to show the picture during my presentation during the business review.
I think you've made some excellent points, and it's clear when you are a traveling fellow how much respect there is for the SRS and all of the host sites. Everyone is very honored to host the traveling fellows, and so you really get to see the best of each institution, but it's also a representation of how they feel about the SRS in general. Dr. Yazici, any moments where you felt that this was why you had come on the traveling fellowship?
No, because I'm probably the most experienced traveling fellows because I did it twice. I did the only member of SRS. I did this program twice, one in the junior, one in the senior. I was the traveling fellow in 2002, 23 years ago. I had some experience since then. And when I was working on the plan, and I still use that information I got from that days. One of the reasons that we just travel all the East Coast to make the shorter the travel and to make it more comfortable, because we visited the 9 cities, 9 states. At that time, we made a zigzag over the American map. It was fantastic. When I'm looking back, I'm keeping this connection I made it at that time. This traveling fellowship program, even in 2002, made a great contribution in my career, and this connection really helped me to step up in the SRS ladder up to the leadership. But it's really time consuming, and packing and unpacking and traveling 4 hours, even some the red-eye flights. This was not easy, but this time, as Sebastien said, we just the longest flight between the Philadelphia to Dallas is 3 hours. Rest of them is less than 2 hours. This was very good, and also because of long weekends, we had a very, very nice relaxing time between two. That's why the program is not really fully packed. It's packed, but it's not only scientifically, but also socially. That's why when I got this invitation, I thought a few days because of Dashton text me and send me an email. I don't know which way. And I thought a couple of days because I'm still active in practice. I mean, they live in the practice 1 month. It's not easy in my age of career. But when I remember my previous experience, I said, this is really unique. I should do it. So that's why before coming here, I already knew what are expecting me. That's why nothing is surprise to me, and also we were treated amazingly. We are so thankful, all our guests. I mean, all the centers we visited, no doubt, center of excellence, state-of-the-art job, but from the human being, friendship, and the other social things. It's amazing. We are so thankful. Every time we are discussing our between us, this is such an amazing host. We had the chance to meet together. I personally knew all of them, but once again, I mean, rebuilt, rejuvenate my old relationship. And then, at the end of the day, I just told myself this was really a good choice they made. And also another chance to me, I'm so lucky, I feel so lucky. I have 3 wonderful young gentlemen to travel with because, as the nun said, over the 3 years, also you know, after the few days, we are becoming family.
You are.
If you are not, I mean, understanding each other, these 3 weeks would be a disaster. That's why we have fantastic time spent together. I mean, there's a very common phrase, people know each other when they're traveling together.
Your family for life now.
Exactly. That's why I'm so grateful.
All right, I'm going to switch gears. What difference in scoliosis care did you notice between either institutions or countries, and how did that compare to your own experiences?
Okay, because in China I'm practicing at the PFC, which is the best hospital in China. So basically, we also have large volume of spinal deformity. We do both peds and adults. So basically, I think all the centers that we visited in North America, they are trying to provide the best of the best medical care for all the patients. So I'm very grateful for the dedication for all the doctors, surgeons. On the other hand, I think we are using the cutting edge technology by integrating the AI technology or precision medical care to the patients. But in terms of differences, I think, for example, we are doing some kind of different techniques to, for example, like traction. In our institute, we do mostly for the halo pelvis, but here in North America, you do mostly for the halo gravity. I think these are technical differences, but we are trying to, find the kind of same result shooting for the same result for all the patients. So I think that's the goal of exchange, because we get to know each other and we communicate and we give lectures and then we get feedback. So interestingly, I think we were told that we can talk about the others, kind of give each other's talk when we finish the fellowship. Yes. But actually it turns out every kind of presentation, all of us are still improving. I mean, even at the end of the presentation, we still have new data, new thoughts putting into the slides. So I think this is kind of mutual collaboration, mutual study. So basically, so I think this is a way kind of we are working on for the kind of during the trip for not only improving by ourselves, but also studying from the different sides. On the other hand, I think although we have very large volume patient, but we still need to learn how to provide the best of the best, high quality, most high quality care for every patient. But sometimes, sometimes it's not easy to balance especially the quality and the quantity. But in our center, we just don't want to maintain the quality. On the other hand, I think the medical care system is a little different from the Western part, very different. But for example, I think you spend lots of money for medical care for the whole population. In our country, we also spend a small portion of the GDP, but I think these are kind of different things.
Very quick one. Just I found that because of system differences and maybe because of the way insurance is charging, we tend to choose a little bit more on a low density type of construct for Singapore because of there is a out of pocket payment for some of our patients, and as a result of that, we have that in the back of our mind in regard to what we want to use for each case. And in the clinic setting, I found that we probably can spend a bit more time because it's a bit more rushed back home, because sometimes we have quite a number of patients listed per clinic, and And so I think that was something that I took home in regards to the level of explanation, and maybe it's not so much just from the doctor, but also from the team that is teeing up the patient for surgery, from the nurse practitioner, from the physician assistant. All these are, I would say, the real helping hands of the surgeon to bring the patient from the start to the end point of their treatment. So, yeah.
Very good. Sebastian.
Yeah. So I would say that in terms of philosophy of management for deformity patients, there are probably not so much differences between here and Europe. Probably because all the guys that we visited are part of the SRS, meaning that they try to provide the best treatments as do we. I would say that the main differences that I noted are maybe more on the organization of things. Like, for example, the outpatient clinics seems to be really well organized here, with a pass for the patient very, very well organized, which is not the case like in France. Typically in my hospital, a little bit more Latin kind of disorganization, I would say. And another thing is that all the tools available in the UR, especially the 3D imaging or navigation system, we have them as well, but not we don't use them as systematically as they do in here, and probably we should tend to use them more.
Excellent. Obviously, we'll have future SRS traveling fellows. What advice do you have for them? I always start with Reuben this time.
Okay. So I think the first thing is spend some time to talk to your spouse. Yeah, because it's a long period, and I think every one of us recognizes that our family is the supporting structure behind us coming out for this fellowship. So spend some time to have that chit chat, spend a bit more time with them in the run up to the time that you're away. And also for your work side of the house, I would say, because many of us are taking on quite a fair number of responsibilities, sort of prime your colleagues to help you from the start of the year, maybe even to and try to apportion it over 4 to 5 different people, so that at least no one feels unduly burdened when they're taking on more duties because you are away for the fellowship. And of course, lastly, this is, of course, everybody will be doing this. Bring home something small for all of them. Yeah.
Sebastian?
Yeah, I have one advice is go for it. It's an amazing experience. Of course, you need to discuss with your family before, but we will have to pay back at a point, I'm pretty sure. But anyway, it's an amazing experience, and I think everybody can benefit from it, so go for it.
Absolutely.
Just one sentence. So take every moment you can to take the rest.
All right, last thing. One word to describe your fellowship experience. One word. Lightning round. Here we go.
Unbelievable.
Unbelievable. Okay, Reuben?
It's exhilarating.
Exhilarating.
Bridges or bridging.
Bridging. Oh, I like that one.
Work to do. Work to do.
Excellent. All right. Thank you all very much. And thank you to our audience for listening. We appreciate you, and we'll see you for the next podcast.
Thank you.
Thank you.